When is hand surgery necessary and is it safe? What are the risk factors associated with hand surgery? Will physical therapy be necessary following hand surgery? Will the hand be as good as new? Hello, my name is Attorney Ramsey Bahrawy, and welcome to Your Money, Your Life. In this segment, we'll be discussing disabling hand ailments, whether due to trauma, repetitive use, or degenerative joint conditions. I'd like to welcome Dr. Stephen Margles of Leahy Clinic as my guest. He's an orthopedic surgeon who has specialized in hand surgery for 32 years. He's also the team physician for Classic Entertainment and Sports, a professional boxing enterprise. Dr. Margles, welcome to Your Money, Your Life. It's great to have you on the program.
Thank you. It's very, very nice to be here.
It's a pleasure. Now, let's first start with the fact that people use their hands for many things in life. And over time, obviously, their hands are going to take a beating. Injuries that are caused by trauma.
Okay.
Okay. Now, as I said in my opening, you in fact are the team physician, and you have treated boxers.
Yes.
And in fact, you've treated some boxers who are relatively well known. So I was wondering if you were willing to share some of your experiences in terms of traumatic hand injuries.
Sure. Well, of course, as you know, the boxer who got me into boxing is Mickey Ward. And Mickey, of course, is now, I mean, he's been internationally famous in the boxing world for quite some time, but he's now internationally famous, I think, in the whole world because of the movie The Fighter that Mark Wahlberg just completed and got a couple of nice Academy Awards. So, unfortunately, my part in the story didn't seem to add to Mark Wahlberg's conception. So, and I actually don't disagree with him. I've seen the movie. It's a great movie. Actually went to the opening. That was a real blast because Mark Wahlberg was there, but the real blast was seeing all the real people all there on the screen.
Of course,
and then I would say Mark Wahlberg and Christian Bale got Dickie Eklund and Mickey Ward just perfectly. I mean, Mickey's very quiet. If you ever meet Mickey, you'd never realize he was internationally famous. He's about as low-key and unpresuming a guy as you ever want to meet. And Dickie's like all over the place. He's bouncing off the walls, just like Christian Bale's portrayal.
So how is it that you got involved with Mickey Ward?
Well, Mickey was in boxing for a long time, and Mickey is a power puncher, and he does have a problem that is very characteristic of power punchers in that they get arthritis at a particular joint at the base of the index and middle fingers right down here. Normally these joints don't have a lot of motion, and for that reason a good boxer punches and hits with these two knuckles. That transmits the force all the way up the arm. And so after doing that for a number of years, he wore the joint out, so he couldn't punch anymore, and he was having a lot of pain. The movie portrayed the policeman hitting him with the billy stick, and that's true, that happened, but that wasn't his major disability, and they didn't portray in the movie any disability referable to that. But he actually couldn't punch anymore. He was referred to me by an orthopedic surgeon from Lowell, and we operated on him. We did a procedure where it's called a fusion or an arthrodesis, where you take a joint, eliminate it, put bone graft in, and make it into one bone.
I see.
So there's no longer a joint there. So now, and because there's normally no motion there anyway, there's no stiffness, and he could now punch again. That was got me into boxing because 3 minutes after the end of the movie, when Mickey's there like this, and the movie cuts out, he was interviewed, and he was asked, Mickey, your career was going nowhere, and here you are, you just won this world championship. How did that happen? He said, oh. He remembered, because I'd asked him to, actually. He said...
You asked him to?
I said, Mickey, when you win the world championship, I want you to give me a little PR. So he said, oh yeah, I got to thank Dr. Stephen Margles at the Leahy Clinic for saving my right hand. So Jimmy Birchfield, who is the promoter for Classic Entertainment and Sports, and his most famous fighter that, again, anyone who follows fighting knows was Vinnie Pazienzia. He now goes by Vinnie Paz. And he was having a problem. So they brought Vinnie to me, and I operated on Vinnie, and then they had other problems, and then they started wanting me to come to their fights so I could do some night of fight stuff, and now I take care of all their fighters. I go to their fights, and I take care of them there, and if they need surgery, obviously, we bring him back to Leahy, and we do the surgery there.
Well, as a matter of disclosure, you actually took me to one of the fights, and I sat ringside with you, and we watched, I forget, was it 6 fights or something like that?
Yeah, it was probably 6 fights. Yeah, I don't remember. Was that, nobody was hurt? Was anybody hurt that?
And the last fight was somebody you had operated
Yeah.
on, and I remember he was speaking highly of you.
Yeah,
I couldn't even see a scar on his hand. He was showing me his hand where supposedly there was a scar.
Well, that fighter doesn't have a scar. And
Okay,
that was
that's why I didn't see one.
Yeah, because he broke his third metacarpal right across in as he knocked out this guy in the first round, and they brought me back into the locker room, and it was totally unstable. And so what I did is, and what I've been doing now more commonly with boxers, is you reduce it with a fluoroscope, an X-ray machine, and to put wires from here across the fracture site all the way down.
Mm-hmm.
And the big advantage of that is that you don't disrupt the blood supply. When you anytime you open a fracture, you disrupt it to some extent the blood supply if you end up putting a plate on it.
Mm-hmm.
Plus, although I do have some plates on a couple of boxers, and a plate being a small metal thing. It's, not talking a dinner plate here.
Mm-hmm.
And you hold it on with screws. But if you take them out, that's another downtime. The boxers have considerations that you don't have with other people, in that they're going to do usually whatever the mechanism of the injury was that caused the first injury, they're going to do it again. Okay. You can't say be careful, you know. Yeah. And there are certain things you might fix with soft tissues in a non-contact sport person, but in a boxer you're going to do something that's a little bit more rigid, which usually means fusions. So boxers get that. They do get soft tissue injuries.
Now, do you find that other than bone injuries, do boxers have any other, do they injure tendons in their hand?
Yeah,
or?
there's a thing called a boxer's knuckle that, and again, the hand is rather complex and sort of hard to show, but these tendons have to be centralized on top of the joint here. If they slip off to the side, then when you try to straighten your finger, it'll lag down. And so when they have that, you have to reconstruct the pulley system. I've been fortunate enough in most of the boxers not to actually have to operate on that. I've gotten them better conservatively with rest. They haven't been so bad that there was no way, but I did have one in a 55-year-old guy that I did the other day. It's worked. I just saw him the other day, and he's great. He's got his hand up straight and down. But that's a tricky operation, because you're reconstructing pulleys, and the hand is so different than most other parts of the body, in that when it's all done, everything has to have healed, and then people have to have the motion. If you just get things healed with no motion, it's it's a failure. I frequently say to patients, if a general surgeon takes out your appendix, and 8 days later you're still alive, that operation was a success. Not so in hand surgery.
Right. So we learned that as Americans live increasingly longer lives, many find that they develop hand pain requiring medical care and even surgery. However, just like any type of surgery, hand surgery also has its risks. Patients face scars, bleeding, infection, reoperation, post-operative rehabilitation, and dislocation. However, despite the risks, we learned that the results of hand surgery are usually quite good. We learned from Dr. Margles that following hand surgery, most people live happier lives with less discomfort and impairment. In other words, the quality of their lives has improved. Just as is the case with any medical condition, before you decide on surgery, do your homework. Take stock of your lifestyle. Do you enjoy leading an active lifestyle and frequently participating in various activities? Is your condition disabling? Is it time to regain your quality of life? If so, remember to choose a skilled and experienced physician with a good track record of providing a high level of expert and compassionate medical care. And lastly, educate yourself so that you become more aware about the risks and benefits associated with surgery. For as Ben Franklin is quoted as saying, an investment in knowledge always pays the best interest. In closing, thanks to Dr. Margles, call you the fight doctor, if you don't mind, of Leahy Clinic for participating in this program. And as usual, thank you to you, our viewers, for watching Your Money, Your Life. My name is Attorney Ramsey Bahrawy, building your trust.